Hi, hi all. So today we are going to discuss regarding home oxygen therapy. So till now we have discussed all the three four methods of oxygen administration. So now we are going to or now we are moving on to the home oxygen therapy. So what do you mean by home oxygen therapy? So in the word itself you will be able to identify oxygen treatment, or as a treatment base we are giving oxygen in home atmosphere. So home oxygen therapy is available to clients who are require continuous oxygen therapy at home. So who all needed continuous oxygen therapy, and there is no need of staying in the hospital. In home itself, in home settings we can administer oxygen. So it is usually delivered by nasal cannula. You can see the delivery system, the oxygen delivery system will be through nasal cannula usually. Next is the preparation. So as a preparation base, we have to explain the procedure step by step to the patient and their relatives for their confidence, and explain about all the safety precaution, because whatever main precautions is there related to oxygen or oxygen therapy, everything we have to explain to the patient and to the relatives. Because once if we are demonstrating or if we are explaining in front of them, next time maybe in front of the sister or nurse or whoever is coming to take care of the patient, in front of them the relatives will be able to administer oxygen. Next, classification. So in this home oxygen therapy, there is three types of oxygen is used. So first one is compressed oxygen, that is normal oxygen cylinders. In the picture you can see the normal oxygen cylinders. That first one. Second one is liquid oxygen. So here in that picture, that is the liquid oxygen administration machine. Okay, so there liquid oxygen will be there. And last one is oxygen concentration. So oxygen concentration machine is there in the picture. So there we can connect the nasal no oxygen tubing, and with that other end of the tubing we can connect the nasal cannula also. So what are the equipments will be needed? So nasal cannula, all the equipments what is needed for delivering oxygen, that should be there. And primary and portable liquid oxygen source for the ambulation. So ambulation is the ability to walk. So while walking itself we can administer oxygen, and with that oxygen we can walk also. Okay, freely we can move. So in the picture you can see the portable oxygen. So in one side of the shoulder you can put that bag, like bag it will be, and there we can connect the oxygen tube, and nasal cannula also we can connect. So with that oxygen will be delivered to the particular patient. Next is the last main is procedure. So explain the procedure to the client and family, then wash your hands, demonstrate step for the preparation and completion of oxygen therapy. Prepare the primary and portable oxygen. Place the primary oxygen source in a clutter-free environment. Check the oxygen levels of both the source by reading the gauge on top. So gauge reading will be there. So with that we can identify, if we are checking that oxygen level or oxygen gauge, we will be able to determine the fullness of portable source, how much is there, is it empty, or is it oxygen is there or not, that we will be able to identify. Check the prescribed rate. So how much is doctor prescribed, that you have to check it. Connect the nasal cannula and oxygen tubing to the oxygen source, where we have to from where we have to get, it may be cylinder, it may be portable oxygen, whatever it is, there we have to collect the oxygen tubing and cannula, then have the client and family perform each step with the guidance from the nurse. So once if the nurse is demonstrating all the steps, next time the client itself or the family members can perform each step under the guidance of nurse. So this is about the procedure of home oxygen therapy. Thank you.